Hi, today I'm in my Hawke's Bay clinic and I wanted to talk about ptosis. Ptosis is when the eyelid muscle, the levator palpebrae superioris, which holds the eyelid open, essentially slips and means that the eyelid is sitting low, and it can be sitting close to where your pupils are and it can make it difficult to see. Or it might be that people are telling you that you look tired. You look tired or angry or suspicious. And people are like, I feel great and I don't want to be, I want my eyes to reflect how I'm feeling. So we can sort that out with a ptosis repair. So essentially, the eyelid muscle sits behind the eye, because you don't want a bulky muscle sitting in your eyelid. So it sits behind the eye and it sends a sheet into the eyelid. And with ptosis, with involutional ptosis or ptosis that just occurs over time, it might occur with like eye rubbing, or it might occur if you're putting in contact lenses all the time, or it might be a family history that you have of ptosis or droopy eyelids. And basically, instead of a sheet coming into the eyelid, it becomes more like bubble gum and it's stretched. So the muscle's still functioning well, it's just not working very efficiently. So to repair that, I need to go into the eyelid and find that muscle. I need to pull that sheet up. You pull it up like a duvet, and you're really wanting to lift the eyelid just usually 2 or 3 millimeters. You don't want to leave the people looking startled. You just want it to look fresh and people look awake and see their eyes. And this surgery is usually done under local anesthetic. I like to do it under local anesthetic because I can look at patients' eyelids in real time and see where the eyelids are sitting to make sure we have the best result. It can be done either through an anterior approach, and if I'm taking a little bit of excess skin or doing a mini blepharoplasty at the same time, I'll go through the front and I'll find the muscle and pull it up. Or if people don't have any excess skin on the front, and maybe some people, either if they're younger and they don't have excess skin, or as they're aging, the eyes are sitting further back into the socket and they don't have excess skin, you might choose to do a posterior approach ptosis repair, which is a scalous approach, which is subconjunctival or from the underside of the eyelid. Both of these surgeries take about 45 minutes to an hour under local anesthetic in our procedure room next door. As with our blepharoplasty surgery, we do everything we can to make you feel nice and comfortable. Risks are the same with any eyelid surgery: bleeding and bruising, infection, scar and numbness. And to minimize your chance of bruising and to improve your healing response, I fully recommend rest in ice for 3 or 4 days after surgery. Other risks: eyelids are sisters or brothers but not twins, so there's natural asymmetries between the two eyes. I do everything I can to make the eyelids nice and symmetrical. There's always a risk to the vision when you operate near the eyes, but I haven't had any troubles. It's important when you're giving informed consent to let people know all the risks that can occur with surgery. I usually see people at a week and see how eyelids are healing, and you have access to me should you have any questions in the interim. Let me know. See you later.